sugar is known, low blood sugar is known as hypoglycemia. And type 2 diabetes can experience both high or low blood sugars. Many type 2 diabetics may not have any symptoms, so they may not realize that they have diabetes. Diabetes is one of the leading causes of kidney disease. It can cause damage to the filtering cells within the kidney. And this damage tends to happen over time. And many people with type 1 and type 2 diabetes can end up with kidney disease and eventual kidney failure. A kidney transplant is the best treatment option for those who have end-stage kidney disease. And this includes people who have diabetes. There are some misconceptions that diabetics are not able to have a kidney transplant, and that's simply not true. Of course, that being said, there are individuals with health and medical conditions that may not allow them to have a kidney transplant. So it's important that you speak with your nephrologist and your kidney care team about this. Many type 1 diabetics are, as well as some type 2 diabetics, have some options in regard to kidney transplant. Firstly, a person can receive just a kidney transplant by itself. This can be from a living kidney donor or a deceased donor. There is the option for a simultaneous kidney pancreas, also known as a KP transplant. And these organs would come from a deceased donor. In this situation, the recipient would not have a living kidney donor, and a pancreas can only come from a deceased donor. Usually individuals are on the deceased donor wait list for a shorter amount of time because their status is higher priority because they are waiting for 2 organs rather than just 1. There's also the possibility of a pancreas and after a kidney transplant. So in this scenario, you would receive a kidney from a living donor, and once you're well and stable after kidney transplant, you would then be put onto the deceased donor wait list for a pancreas. And lastly, there may be the option to do a pancreas or islet cell transplant alone. Only a small percentage of pancreas alone transplants take place, and it's usually in persons who are non-uremic. That's meaning that they do not have any significant renal dysfunction and no symptoms from their kidney disease. And they have very brittle diabetes, which includes recurring episodes of low blood sugar and high blood sugar. Islet cells are cells within the pancreas that create insulin. The insulin is released into the bloodstream and helps to control the blood sugars. Islet cell transplant may occur on a type 1 diabetic where the deceased donor pancreas is too damaged. Sorry, that just came up on my screen. Where the pancreas is too damaged from trauma, but the islet cells are still useful. The islet cells are removed from the deceased donor pancreas and put into the recipient's bloodstream. Islet cell transplants happen less frequently, but usually it's preferred to have a pancreas transplant when possible. And recipients may need to have more than 1 infusion of the islet cells. In my career, I have seen a situation where a person was to have a simultaneous deceased donor kidney and pancreas transplant, and they received the kidney, but there was significant trauma to the pancreas. So the patient did not receive the organ of the pancreas, but they did receive an islet cell transplant instead. Not all type 2 diabetics can be considered for a kidney pancreas transplant. Usually they would have to be on insulin for about 5 years or more. With some patients, some patients already have diabetes before kidney transplant. There are those that may have developed diabetes afterwards. And this happens because of the anti-rejection medications that they're taking that to protect the kidney that they have had transplanted. A person would be at higher risk for developing diabetes after a kidney transplant if your family has a history of diabetes, or if your blood sugars were running a bit high prior to transplant. The treatment of diabetes depends on how severe your diabetes is. So if your blood sugars are only a bit elevated, it may be enough to manage your sugars by the food that you eat, and perhaps take medication to manage, to help the insulin work better in your body. There are some cases where a person may be required to start taking insulin after a kidney transplant when they develop diabetes. Normally, we would refer a diabetic patient after kidney transplant to a diabetic care clinic for assistance in managing the diabetes. So that would include education about the insulin, how to take your medications, diet, and so on. I always encourage my patients, whether they have diabetes before or after transplant, to eat healthy, maintain good control of their blood sugars, exercise, drink plenty of water, take their medications appropriately, and get as much rest as possible. Even doing all of these things, there may still be a chance that you develop diabetes after transplant. All you can do is take the best care of yourself as possible. Many patients are afraid of developing diabetes. Yes, it's a scary and serious disease, but if you take the best care of yourself as possible by carefully controlling your blood sugars, this lowers your risks of having kidney problems. I get asked often if potential kidney donors can donate if they have diabetes, or if their diabetes is extremely well controlled. Unfortunately, the answer is no. You would have to think of it in terms of diabetes is one of the leading causes of kidney disease, and we would never remove a kidney of a diabetic only to put that patient at greater risk of developing kidney disease themselves. Don't forget, they would only have one kidney, and with a disease like diabetes, even a bit of damage to the remaining kidney could be detrimental. Even the most well-controlled diabetic would be at greater risk of developing kidney disease. In the end, that person would end up in the same place as the intended recipient. As much as a person wishes to help their loved one, ultimately, we can't put another individual at risk. So to sum up this information, diabetes is a disease which affects the pancreas' ability to produce insulin, or the ability to produce enough insulin, and the body's ability to properly use the insulin. This can cause hyperglycemia and or hypoglycemia, so high or low blood sugars. Diabetes has many symptoms and requires good control to help decrease the effects on the kidneys. Diabetics can be considered for a kidney transplant, and in some circumstances could even be considered for a kidney pancreas transplant. There are options. Even if you have a living kidney donor, there is the possibility of being considered for a pancreas transplant after you receive your kidney. There is the possibility of some kidney transplant recipients developing diabetes after transplant. And this happens if you are at high risk before your transplant and is caused by your immunosuppression medications you take to keep your body from rejecting the kidney. Your nephrologist and kidney care team will support you through this. And lastly, potential kidney donors who have diabetes, whether it's well controlled or not, are not eligible to be a kidney donor. And that concludes my portion of this evening's talk. Thank you for your attention.
Thank you, Stacy. That was great information. We appreciate that. I know you're going to stay on for a little bit as long as your internet allows you to. So, but we'll ask people to hold questions until the end. We'll make sure there's time for questions. Alex, would you mind sharing the short presentation that we have now? I'm going to, I think Alex is going to share that. Are you going to share the presentation, Alex? Here we go. Okay. Hopefully everybody can see that. Thumbs up. Yeah. Okay, great. Just a really quick overview of the Transplant Ambassador Program. The folks, that's us who are hosting the program with you tonight. I think we might have missed a slide. Did we, Alex? The first slide. Yeah. Okay. So this is no, that's okay. Just we can go to the next slide then. So this is all the folks that you're going to hear from tonight with 1+ and 1-. Their Transplant Ambassador emails are all here on the right, and they encourage and invite you to reach out to them. Alex will also be putting their emails in the chat, and everyone's available. I'd also want to acknowledge there are many other ambassadors here with us tonight. Thanks for joining us. You may recognize them by their vests. And we appreciate you coming to learn more about this topic and from your fellow ambassadors. Next slide, please. So all of us in the Transplant Ambassador Program are either kidney donors, living kidney donors, or transplant recipients who are currently living with a successful transplant, either from a living donor or from a deceased donor. And our goal when we kicked off the program in 2017 was to be able to connect with patients at all stages of kidney disease, ideally at the earliest stages, so that we can share our experiences and things that we knew or didn't know earlier, and that might help you along your journey if you're also a kidney patient. After COVID hit in the mid and early 2020, we moved our program to virtual. So we now offer, to connect with you by phone or by Zoom Medical, which is an encrypted private version of Zoom, which ensures your confidentiality. We do hope to be going back to clinic sometime this year, and some of us have already started to do that. Next slide, please. So this is, just who we are. TAP is really, we are peer support, in the true sense of the word. We've all had this kidney experience and want to share it with others who are going through it. And we think that this mantra of one day you'll tell your story about how you overcame what you're going through now, and it will become part of someone else's survival guide. That's what's happened to us. And we certainly hope and believe that that's going to be happening to you too. It's very much about experiential learning, providing hope and inspiration. And earlier, when in those early days of when you're first diagnosed and when you're getting sicker, that there are living examples of people who have made it through this process and made it through successfully. And of course, it's not just about talking about transplant, but it's also talking about our experiences on dialysis, our experiences with our families, just really support in general to help you through your journey. Next slide, please, Alex. One of the things about TAP that maybe is a little bit different than some of the other peer support programs out there, and they are all great and they're all amazing, and people should tap into whatever support is available for them and helps them. But all of our ambassadors are have all gone through the vulnerable police check process. They're all trained by TAP, and they're all onboarded as volunteers at one of the hospitals in Ontario. We do follow fairly strict privacy and confidentiality protocols. We're also very much data driven. We record all of our numbers, not details about the individuals we talk to, but numbers of who we spoke with. And we are really trying to assess whether or not we are able to increase the transplant rates in the centers where we're working. We look in the ideal world to build an ongoing relationship with everyone we talk to. Sometimes we talk to people once, and sometimes we talk to them multiple times as they're going through the process. our goal with the program is to match people who have similar, either similar backgrounds, are similar kidney journeys, may speak the same language, maybe the same age, the same gender, so that they can really connect with someone who seems to relate to them as best they can. And to do that, that's one of the things that the Provincial virtual program has allowed us to do, is really connect people from across the province with people who they feel really comfortable with. You can reach out to all of us through our emails, as we mentioned already, and that we do work with all of the renal centers in Ontario, all 27 of them, including Stacey's Center up in Thunder Bay, so that people can see, both living donors and transplant recipients throughout their journey. And lastly, and I think really importantly, is we're all volunteers, we're all patients, and we all, take a role in running this program, which makes it really special. Next slide, please. This is kind of a complex slide, but all it really means is that the Transplant Ambassador program is part of an initiative with the Ontario Renal Network and Trillium Gift of Life in Ontario to increase transplant rates by providing more support, more education, more accountability. And our goal in phase 2 of our program is to increase transplants to 300 annually. This is living donor transplants to 300 annually by 2025. Right now, I think it was 242 last year. So we're looking at an increase of about 60 a year. Next slide, please. This is just to give you a little bit of context. Yeah, so that's some of how many transplants there have been, both with deceased donors and living donors in Ontario since 2018. So that gives you a little bit of a sense of the numbers. You can see in 2020 there was a big dip because of COVID, but we're starting to catch up now. We're part of a large group of folks now in Ontario, 10,000 people who are receiving care in multi-care kidney clinics and 12,000 people in Ontario who are on dialysis. So there's a lot of us out there, and a lot of us who kind of feel alone. And so one of our goals is to make sure that people don't feel alone, and that there is an opportunity to reach out and speak with someone. Next slide, please, Alex. So we encourage you to have a look at our Transplant Ambassador website. It's www.transplantambassadors.ca. On there, if you click on the top right-hand side, you'll see a new feature of our website, which is an ambassador directory. It lists most of our 150 ambassadors. We're getting them all on there, slowly but surely, at all 27 renal centers. And the nice thing about this legend at the top is you can click on any of these tiles, such as other languages or over 65 at the time of transplant surgery, and narrow down your search to the right person, the person that you want to talk to in this. And that's our goal, is to make it easy for you. You can also send them an email directly from this website. Next slide, please, Alex. This is a new feature of our website that may interest you if you are a kidney patient who who's looking toward either a preemptive transplant or a transplant in general. We're launching a new page on our site called Patients Seeking Donors. And you'll be able to go in and look at any of these profiles. These are all actually real people when it goes live. Next slide, please. And you will be able to click on one of them, any of them, and you'll see a little bit more detail about them. So, this particular fellow has provided a little bit of information about who he is and his background and why he's looking for a transplant. And we believe, next slide, please, Alex. We believe that that it's really important to provide patients with the help and support that they need to find a donor if that's what they're looking for. And so we do as much as we possibly can to help with that. If you're on any social media platforms, please look us up. We appreciate your support. And I'm going to now, you can stop the slide program, Alex. We're now going to go to the best part of this evening, and that is really to hear from our panel, our wonderful panel of transplant ambassadors who have lived the experience of kidney disease diabetes and transplant, and they're going to, I think, provide a lot of inspiration for you tonight. So what's going to happen is we're going to ask every ambassador to share a little bit, 4 or 5 minutes of their story, and some of the challenges and obstacles that they overcame. And then at the end, we'll make sure that there's lots of time for questions. So again, I just ask for you to hold your questions, although if you do have any and you want to put them in the chat, we'll do our best to answer them. So I'm going to start the panel off tonight with Brendan. And Brendan, it's all over to you then. Thanks.
All right, you can hear me there? All right, good evening, everybody. My name is Brendan Bird. I am a kidney transplant and also a pancreas transplant recipient. I am a volunteer at the St. Joseph's Hospital in Hamilton. That is also where I received my kidney, and I received my pancreas at the Toronto General Hospital. My kidney failure was a direct result of my diabetes. I was not the best diabetic in my early 20s, 30s. And subsequently, my body decided to stop cooperating. And my kidney failure happened very quickly. From the time that it was diagnosed to the time that I was on dialysis was only about 3.5 months. So my choices of basically going from treatment to dialysis was very quick, and so the idea of transplant wasn't even a question. It was basically, this is what you need to do. It was a very scary situation, going from relatively healthy to having issues with my kidneys. But again, like the team that I was dealing with at St. Joe's, they were great. There was lots of people to talk to, the nurses, the doctors, the counselors, the diabetic specialists. They all were a great team to basically walk me through the process. My diabetes, as I said before my surgery, I tried my best, but I wasn't a very good diabetic. After the surgery, I became the ideal diabetic. I copied every single carbohydrate that went into my body. I carb counted. I had a CGM unit on my arm, so I was constantly monitoring my blood sugars. But after my surgery, I went from having high blood sugars before to having lower blood sugars after. So that was a whole new situation of having to deal with. But again, with the team that I had, with my diabetic specialists, with the transplant clinic, my new tools as the CGM unit, all of these tools helped me deal with my diabetes after the kidney. And then it was strongly suggested, since I was a new kidney recipient, that I should go for a pancreas. And that was one of the things that we were talking with very shortly after the surgery. And I was all for it because the idea of not being a diabetic was just tremendous. The barrier that I kind of faced with the diabetes is that I was uncertain as to my health going in, because my health was really up and down. Like, I spent more time in the hospital than I felt like I spent at home. So I was wondering if that was going to be a situation that was going to lead me to not be eligible to be a donor, or to be a recipient, sorry. But because of that situation, because of my younger age, I'm presently 45, me getting a kidney was going to be the best thing for me moving ahead and increasing my livelihood, increasing my life quality of life moving forward. What else do I have? The transplant workup was all done at St. Joe's. Some of the blood work and so on was able to be done at my local hospital. I live in Dunnville, so it's about an hour's drive for me to get back and forth to Hamilton. So luckily I was able to do some of the work right in my local hospital or at my doctor's office. So it made the process, even though it did feel like it was a long process, it still went by fairly quickly, because there was dealing with the dialysis at the same time. But all in all, it went very well, and I'm extremely glad that I went through with the whole process. And I think that's about all I have to say right now. But if anybody has any questions, I'll be happy to answer them at the end of the program.
Thanks so much, Brendan. Really appreciate hearing more about your story. I think you have a couple of young kids at home too that you were kind of supporting you through all of this as well. We're going to move next to Maria and hear a little bit about her story. Maria, you're up next.
Oh, hello, everyone. I'm Maria Allen, TAP ambassador at St. Joe's, Hamilton, and I'm a kidney transplant recipient for 15 years. So my transplant journey started unexpectedly in December 2006. My family doctor sent me to Joe Brand here in Burlington for endoscopy, as I was suspected to have GI bleeding. The reason for my low hemoglobin. So while I was being prepared for endoscopy, I asked the doctors if I can call my brother in the States. So my brother told the doctors if they could check my kidney function. And my creatinine was 1500 and the normal level is 100. So they stopped the endoscopy. And then immediately transferred me to St. Joe's, where I received the the tube insertion, and they did the dialysis right away. So for the next 6 months, from December to June, I did dialysis at St. Joe's 3 times a week, and then my nephrologist then told me that with my blood type, I would be waiting 10 years for a cadaver donor. So my family decided that I go home to my birth country in the Philippines. So St. Joe's did all the, what do you call it? The workup. So they sent my serum through FedEx, and then, so the kidney hospital in Manila did all the coordination with St. Joe's. And by July, in July of 2007, I received a kidney, from anonymous donor. So 15 years ago, there was very limited resources in, here in Canada. So there was no TAP ambassadors to help. So you're pretty much on your own, aside from the social worker who would check on you how you're doing. But now, things are different. There's TAP ambassadors and there's a lot of resources. So before I had my transplant, I was not diabetic. And 4 years after my transplant, I became diabetic, with all the medications I'm taking. So I'm not the best diabetic patient. I don't have discipline, but I'm trying, I'm trying to work on my sugar level. I'm on Ozempic and 3 other oral medication. And I'm seeing an endocrinologist pretty much every 3 months. So so that's my story. And I just want to let everyone know that we are here to help and never to lose hope. That's all. Thank you so much.
Thank you, Maria. It is very inspiring to hear your story. We're up next is Leo. I'm not sure, Leo, if Robin is with you.
No, she's not today.
Okay, no problem. Over to you.
Perfect. Hi, everyone. Good evening. My name is Leo Chaco. I'm in London, Ontario. I did my workup in London, Ontario, and that's also where I volunteer at the London Hospital Science Center. So how I came to realize that I actually had polycystic kidney disease was by accident, and it actually wasn't my accident. It was my mother's accident 33 years ago when they were doing the ultrasound just to check, make sure there weren't any internal injuries. They determined that she actually had polycystic kidney disease. And so she said, well, do you have any children? She's, yep, I've got a twin son and daughter. So let's get them tested. And I guess you could say I drew the short straw on that one. So when I was probably about 20 years old, so I'm 53 right now, I started getting regular follow-ups with the doctor, and just there really wasn't a whole lot they could do at that point. So they just kept following me and following me. And so in about 2018, 2019 is when my creatinine numbers really started creeping up. So they said, okay, now we got to really start looking at some options here. Let's get you worked up for a transplant. And also I started looking into dialysis. In the meantime, 2 years prior to that, my mom actually had gone through, I watched her go through dialysis, and she was on the waiting list to get a transplant for about 2 years. And she was actually able to get a deceased donor kidney transplant. So I was firsthand witness to her process and all that she went through. Mind you, she was quite a bit older, 20 years older than me. So things were a little bit more difficult for her, but we were here kind of monitoring her, helping her, assisting and so forth. So it really opened up my eyes as to what to expect, because I knew this was the road that I was going down, and I would be following in her footsteps, so to speak. So I kind of watched and saw some of the struggles that she went through. And it really opened my eyes, and I knew that if I maintained a positive attitude, things would work out fairly well. Watching her go through, she had a knee transplant since as well, so she's still there, she's still kicking and still having fun. Prior to surgery, prior to the transplant, I had type 2 diabetes, and it was controlled with diet and exercise and lifestyle. But after the surgery, and of course the medications that come with the anti-rejection medication that comes with it, my blood sugar numbers were obviously spiking. So we introduced metformin, and metformin by itself was not covering enough. So I started taking, it's called Soliqua. It's an insulin glargine combination once a day. It's an injection. Still a fairly low dose, but blood sugar is controlled, but you still have to maintain, you got to watch what you eat. You got to make sure you get lots of water, exercise. And it is a daily, I wouldn't call it a struggle. It's monitoring what you do, and when you eat something, you are always kind of in the back of your mind thinking, all right, what's the carb count here? And how is this going to affect me? Am I going to feel, yeah, it's going to taste great when I eat it, but what am I going to feel like afterwards? And what are my numbers going to be like afterwards? So is it worth the price that I'm going to pay, so to speak? The transplant workup, it took about a year to go through the transplant workup. And of course, they did say that would be 3 to 5 years for a deceased donor. I do have a twin sister, and obviously she did come forward saying, hey, would you like me to get worked up? She has twin daughters of her own, and I was hesitant to ask her. So we said, well, why don't we try a little bit of a different person first? And my wife volunteered, and she said, let's try me first, and we can use my sister as a backup. So we did the initial testing with my wife, and the blood match came back as a positive match. So again, probably about 8-9 months worth of testing and workup for her as well. And she was able to actually give me a kidney. So in 2020 of September, in the middle of COVID, two of us went into the hospital, and we went through the process. Both of us had slight complications. We were out in about 8 days. The one thing that I did find about recovery after the surgery, and of course, I remember hearing from my mom and the nurses and doctors when my mom went through this, is as soon as you can, start to walk. So here I am, day 2 after surgery. I've got 2 IV poles and 2 nurses, and I'm walking down, and the transplant unit at London Health Sciences is a bit of an oval. The first day I could manage half of the oval, and by the 7th or 8th day, I was doing multiple laps, multiple times a day, and it was very, very painful and very, very uncomfortable. But I think pushing myself in that respect helped me recover faster. If I can give any advice on anyone who's looking at prospective surgery and or either being a donor or receiving a transplant, if you can, as much as possible, get yourself in as good a shape as you can prior to, because it will aid your ability to recover faster. And a positive mental attitude will also get you a lot further, because there will be challenges and there will be things that are out of your control. So focus on the things that you can control and positive thoughts to the universe. You will be rewarded. And that's my story.
Thank you, Leo. You know, I don't know if it's the power of Zoom, but you look the picture of health today. So
Thank you.
done something right. Thanks for sharing your story. Jarrett, are you with us? I saw you enjoying the outdoors a minute ago.
Yeah, so I was having some technical difficulties, so I moved inside. Thanks, Sue. I am here today. My name is Jared Javan, and I'm a transplant ambassador recipient for St. Joe's Hamilton Healthcare, where I had my workup and eventual transplant. I was diagnosed with kidney disease on my 43rd birthday, quite a birthday present. The nephrologist said, you know, you not only have kidney disease, but you have end-stage renal failure. So that was quite a shock to me, because up until then, I'd led a very active lifestyle. I was an avid runner, and you know, one day I wasn't able to, I didn't have the energy to run. So that's when my kidney journey began. And so I was lucky enough to have a couple friends that came forward that were willing to get worked up and donate. And the first one, when he started his workup, actually he was determined that he was pre-diabetic, and which was a shock to him and to the group of our friends, because he was a very fit guy. And but you know, there is a genetic component to diabetes, and his mom is a diabetic, and so he was precluded from moving forward with transplant. But our mutual friend Chris was able to donate, and everything went well. And so you know, I was diagnosed with kidney disease in 2016 after spending some time with on dialysis, about almost 2 years. I was lucky enough to receive a kidney transplant in 2018. And before that, I wasn't diabetic. You know, I hear elements of my story reflected in Brendan's and Maria's and Leo's story, in that you know, I wasn't diabetic before, but with the anti-rejection drugs, my blood sugars do spike after I take my medications in the morning. And so, you know, if I could give you so actually, you know, post-transplant, the inpatient nephrologist came in and spoke to me and said, you know, I think, you know, you're going to be a type 1 diabetic moving forward. And I said, you know, that's okay. I'm okay with that. It's a small price to pay for the freedom that, you know, a living donor transplant provides, you know, apart, you know, it's an amazing difference between, you know, transplant and dialysis. Dialysis keeps you going, but, you know, a successful transplant gives you back your life and the freedoms that come along with it. And so, you know, I was okay with being, I was on insulin for the first 6 months, but I had said to that, I remember clearly saying to the nephrologist, saying, you know, I hope I'm okay with that, but I hope I'm an aberration. And you know, lo and behold, you know, like Leo said, the power of positive thinking and, positive thoughts. I was off of insulin within 6 months of my transplant. I'm still considered type 2 diabetic, but I control it with diet, exercise, and oral medication. And so, it's been 4.5 years since my transplant, and I'm feeling relatively healthy. Leah does make a good point in terms of thinking about what you're eating, and that there's a trade-off between, those carbs that you're taking in may taste good now, but there is a consequence to that action. And so if I could give any advice, I would say, make sure you're measuring your blood sugar levels. I use the Freestyle Libra. I know there's Dexcom as well that help you and are very easy to help you measure your blood sugar levels. And knowing where you're at is probably the beginning to managing it, and just understanding how your body reacts to certain foods. And that's, it goes a long way to managing your diabetes going forward. So thanks for sharing. And if you have any questions, feel free to reach out to me. I'm here to help.
Great, Jared. Thank you so much. It's great to hear that you're able to manage it without insulin. That's a very positive story. Just a quick time check. We're at 7:22. We have 5 more stories. So if the next panelist could just keep it to 4 minutes or so, that would be amazing. We're going to go to Lyndon next. Lyndon, over to you.
Hi, everyone. Thanks for letting me join and share a little bit about my journey. So I live near London, Ontario now, and volunteer with the London General Hospital. But I had my transplant workup and surgeries in Toronto General Hospital. I had 3 organs transplanted. I first had a liver transplant and then a double kidney pancreas transplant later on. My kidney failure came a long way around. I started in my 20s. I was in university and I came back from a trip abroad and I had an infection, and they discovered my liver enzymes were off, and I was later diagnosed with PSC, which is primary sclerosing cholangitis, which is a liver autoimmune disease. Around that same time, I was diagnosed with type 1 diabetes. So I was around 20, and I managed the diabetes and the liver disease for quite some time. The liver disease, unfortunately, doesn't have any treatment. So I knew pretty well early on that I was going to have a transplant. My kidney failure came afterwards. When my liver got really bad, I had to wait quite a bit for a deceased donor and ended up in the hospital for a long time in a coma. And during that time, I did need dialysis because my kidneys had not been able to manage the stress of the liver. So I knew after my liver transplant that my kidneys would not bounce back. So that they did bounce back a little bit, but that I would eventually need treatment like dialysis or another transplant. So that's sort of how I found out about the kidney failure. So when I first learned about the transplant, some of the feelings were, because I knew I had liver disease as a young person, I knew that transplant was somewhere there in my future. I was trying to prolong it. And then when it did come, I knew it was going to happen, and I knew it was the only thing that would save my life. With the kidney transplant, there was a lot of mixed emotions. I was pretty frustrated that I thought I was getting something to save my life and sort of make things better, so to speak, and then only to find out that it was the beginning of a new health journey. So I sort of battled, I think most of us do, with like frustration on one shoulder and gratitude on the other shoulder, sort of always between like being very grateful that you're alive and that you have treatment and that you had transplant, and the other side of you frustrating a little bit with all the health and the other aspects of what's going on. My diabetes and the managing of it like I said, for many years was pretty good. It was a struggle, like most people have shared, ups and downs. I was type 1, so I managed with insulin, and then always had my sugar or my dextrose handy for my lows, and then for my highs, extra insulin or just monitoring. One thing that I will share a few things that, despite doing my best and having people to help me, like nurses and teams, I did end up having some nerve damage, and I did have an amputation that was due to a very small injury on my toe that I didn't know that I had a vascular disease as a complication of diabetes. It was never diagnosed, and so when I had a small injury, it happened really fast, and there was some trips to different hospitals with different information, and ended up getting an amputation of part of my leg. But the transplant workup was done really well at Toronto General. When I heard I had kidney failure, and I first started working up for just the kidney, but then when I realized that there was the option for a double transplant, I switched over to that program because, as the nurse mentioned, the wait list was shorter, and I had the opportunity to have no more diabetes. And even though the surgery is a bit more difficult and long, a lot of doctors assured me that it was a good option, and I chose that, and I'm really happy with it. In 2019, I had, after about almost 5 years on dialysis, I had a successful double transplant. I was in the hospital a little more than average due to some complications, but ended up going home, and I don't have diabetes anymore, and feel really grateful that I was able to have that option. Just to end, one thing that would have made my life easier, and that I suggest to people, is just always to talk to people and share what you're going through. For a long time, I thought more of it as a weakness, but it can be a strength as well too. And it's not all of you. Your illness is just part of you. Talk to people, ask questions, talk to your friends, and get the support you need during your journey. Thanks, and ask any questions at the end if you have any.
Thank you, Lyndon. I mean, you're such an inspiration, honestly. And you're also, Lyndon also works as a social worker and pays it forward in so many different ways. So thank you, Lyndon, for sharing your story. Dan, over to you.
Thanks, Sue. And just a quick shout out to my fellow ambassadors, the ones who are speaking tonight and the ones who are here for moral support. But most importantly, thanks to all the folks that have allowed us into your living rooms, dens, and in one case, I see a backyard as well. So anyway, as the screen says, my name is Dan Shimsky. I'm a soon to be 61-year-old man. I had my transplant when in early February of 2020. I was diagnosed as a type 1 diabetic back when I was 30 years old. And some 30 years of really terrible food choices and blood sugar control led to kidney disease. Still, that wasn't enough of a wake-up call for me, and ended up needing a transplant. So went on dialysis and immediately started the workup for transplant. The first volunteer to donate a kidney was my wife. So we were fortunate enough that they started her workup at the same time as mine. So it turned out that she was not a match for me. However, we became aware that St. Mike's, which is where I had my transplant done, St. Mike's has a program where if you're, I'm speaking in very simple language because that's all I understand, but if you're close enough, they can do something to basically clean one person's blood to be compatible with the others. So we were blessed to be in that 10% of people that could do that. So went ahead and did that. I was on dialysis for about a year and a half. Some days I came out of there feeling like $1 million. Some days I came out of there feeling like I owed somebody $1 million. But nonetheless, the transplant itself, I would have to say, it was the easiest major surgery I've ever had in my life. I'd also have to say it's the only major surgery that I've had in my life, but seriously, the transplant was a breeze. You know, they give you a little button to push for pain. I only pushed it once to see how it felt. I really didn't have a lot of pain, and I understand that my story is not the same as everybody else's. I immediately felt better. And in fact, the next day, the nurses had me get up, and I walked down to my wife's room, and she took one look at me and she said, "Who the hell are you, and what did you do with my husband?" Immediately, my color was better, everything was better. You know, one metric I like to use is that pre-transplant, I could barely walk 20 steps without sitting down. And now I do on average about 7 to 10 kilometers a day. So, you know, it really I wish I'd taken better care of my diabetes and avoided a lot of this. But, you know, if there's anybody out there that thinks, oh my God, you know, you're getting a new organ put in and it's going to hurt and whatever. Yeah, it may, didn't for me, but at the same time, the benefits. I mean, I lost my hair 6 months after the transplant. Get a little bit back, but again, you know, hair is a small price to pay for the quality of life that I have now. So yeah, and I neglected to mention, I am part of the newly minted Scarborough team of TAP, yay Scarborough. I hear we get some new hospitals and stuff, so that will be nice. In terms of just a plug on diabetes care, two of the things that really helped me a lot, in addition to a stronger resolve to getting the job done, one has been mentioned, the glucose sensor on the arm, and the other is an insulin pump. You know, it does take away a lot of the, you know, you still have to carb count and whatever, but my sugars are way better now with the pump. And that's my story. I'm sticking to it, and I'm happy to share more of it if anybody has questions. Thanks, Sue.
Well, thank you, Dan. That's so great to hear. Kind of you got this new lease on life, and that's quite incredible. Okay, we're going to go next to Barry. Barry, are you there? I know you were here earlier.
Barry's on mute.
Okay. Yeah, we got you. Oh, Barry, you are on mute. Let's see if we can unmute you. Can you unmute?
There, can you hear me now?
Yeah.
Okay. I'm Barry Robson, and I live in Southampton, up on Lake Huron here. I'm 78 years old. I just thought I'd mention that because that always seems to be a concern with a lot of people. I'd been diagnosed with diabetes in the late 1990s, and I'm currently on insulin, have been for quite some time. My creatinine levels were starting to climb, 15 years ago, and I was referred to a nephrologist at University Hospital in London. And I saw them on a regular basis about every 6 months. We started to work up for a transplant quite some time ago, and it was found that I had colon cancer. That was in 2016, and it was removed. It was the early stages, and it was removed, and there was no complications afterwards. But unfortunately, after you have cancer, you have to wait for 3 years before you can get back on the transplant list. So I had a fistula put in, and I started dialysis in the University Hospital, and I traveled from here to London every Monday, Wednesday, and Friday, which is a 3-hour drive down there, a 3-hour drive back. But we did that for about 3 months, and then I got on to the dialysis unit in Owen Sound, which is 35 minutes away. And I was on that from, well, for about 3.5 years until we found, or at least I got called from University Hospital to say they had kidney for me. Well, I got halfway down there and I got a phone call to say that that had been canceled. So unfortunately, we had to wait a little longer, but on January the 10th of 2020, I got the call to come down there at 6 o'clock at night, and in the wee hours of the morning, I had a kidney from a deceased donor, and it's been working terrifically. And I'm so happy that I was able to do that. Now, again, down in March of this year, I got the virus, and that led to pneumonia. And I was in the hospital up here for 2 weeks. I've got over it gradually, but anyways, I'm feeling great now. I guess the only problem with the transplant was that I have skin cancer periodically, and I see a dermatologist every 6 months. I've had several spots removed, and my arms, the skin is very thin anymore, and it seems that every time I bump something, I get a blood blister or something like that. I wear lots of sun protection when I go outside golfing or walking the dog, and so far things are great. I don't know what happened to my picture here. Well, I guess the sun is shining. Anyways, that's the story. I can answer any questions that I've had.
Thank you so much, Barry. That's really inspiring, and I'm so glad that you mentioned your age, because I think you are really an inspiration to a lot of people, and obviously having a really improved quality of life. And we're so happy to have you with us in TAP. So thank you so much. We have 2 more speakers, and I just want to make sure we leave time for questions. So Peter and Fiona, again, if you could stick with your 4 minutes. Fiona is up next.
Hello, my name's Fiona, obviously, and I'm volunteering through the St. Joe's from Hamilton. That's where my workup was done in April of 2018. So this year is my 30-year anniversary of being diagnosed with diabetes. So you can imagine at the age of 13 that this was not a happy moment, and going through high school and having to deal with diabetes and having to, I pretty much said, no, I don't want to deal with it. So after many, many years, once they say that it hits that 20-year mark and you start getting complications, which I did, I got diabetic retinopathy. I also started to have high blood pressure, and that's how my kidney disease presented itself. So they didn't know why I was having extremely high blood pressure. So when they tested things, they did a renal MRI and they noticed there was beating and all this stuff. And then they related it to the kidney, and that's my kidneys were failing. So I dealt with that. That was in 2014. That point, when they decided that I would be having to be worked up for a kidney transplant, my dad stepped forward because he was the only one that was eligible in my family, and he was a match. However, through his workup and my workup at the same time, he was diagnosed with Crohn's. So of course, after 1.5 years, I think it was, he was eliminated. So at that point is when I got put on the list and kind of went, oh, now we're back to square one. So it's a real thing to kind of have that disappointment, or what am I going to do now? No one else could do it. And by the mercy of God, my best friend of 35 years came forward and said, I want to see if I'm a match. And she was a match. And she had her workup done, and which went really fast at that point. However, we had to wait. So hers was done, I remember the date, December 12th of 2017. We heard that we were a match and good to go, except that I had a stroke. So I had to wait, because of the high blood pressure, I had to wait at least 6 months. So my 6-month mark was April, and we had the transplant on the 4th of April. The first day that I could book it was when I was able to do that. And through that, through the one thing that I would mention, the biggest thing about with St. Joe's, and I'm sure other hospitals, is they have such an amazing network of team of people. I said to my nephrology team, I have never really had a doctor, an endocrinologist that I really connected with. And that was part of the problem. I didn't have someone that I could talk to that could manage me, that, you know, there just wasn't that connection. I started out with a youth group, and then transitioning to adult is very difficult. And so they were able to refer me to a team that was within the network. And it's been a life changer meeting them and going through everything. The kidney transplant went very smooth and never had any issues, felt like night and day. And I was able to manage the diabetes, met a new team, went on the insulin pump. And that, like, I think it was Dan that said, insulin pump is the game changer. And I'm now on a pump that has, I do Dexcom for my CGM, and my pump, I switched from Medtronic to Tandem, and they have a new technology that communicates to your CGM and changes your insulin. So it's like your own pancreas is working. So there's lots of new technology that's coming out right now that you're gonna, if you get diabetes after or before you have it, there's so many things. And the one thing that I would say to my younger self, I kind of smack myself in the head and say, you know, you should have managed this, got a team, get on the pump early. I kind of pushed it off because I wasn't ready for it, or it was not the cool thing to do, or I was a little nervous about having something attached to me all the time. I don't even think about it anymore. It's just like that, and life-changing. And then through this network as well, I've been able to go on. I thought about doing the pancreas, chose not to do it, had my diabetes in good order. And I just actually had bariatric surgery 2 weeks ago. And so that's my next journey. That was by choice, but it was also a referral from my kidney team, because the medications, you do put on weight, you do, like, there are some side effects of that. And I thought, okay, this is really ridiculous. I need to get this in. And they were able to support me through that. So there's lots of support, and we're here to talk to everyone. And I see all the different stories, which is great to hear that there's different options for everyone to talk to. So that's my story. Thank you.
Thank you, Fiona. I mean, looking at you, you're just like, honestly, so bubbly and positive, and you've been through so much, and you know what
You have to be. Life is too short. When I had my kidney, it was like, you know what? I can't take for granted what I was doing before. And now it's like the next step. Now my life's going to change. And I think you have to think that way.
Yeah, absolutely. Well, thank you so much. I know you inspired a lot of people tonight. Lastly, but not least, is Peter.
Hi, thanks. Peter Wexelman. I'm with the Grand River Hospital. I had my workup done mostly at Grand River. They're one of their satellites here in Guelph. And I had my surgery at the London Health Sciences Unit at age 70 in 2017. I'm now 75. Things are going great. And myself and Dan and Barry and people like that are examples that don't rule yourself up because of age. So that's one lesson I've learned first of all right there. The second lesson is they say you should never follow an act that has children or animals. Well, try following an act with 9 or 8 other transplant ambassadors who had compelling stories. So everybody has a piece of the story that I have, you know, or we're all sort of in the same boat in many ways. So I hope I'm not boring everybody by repeating everything, and I'll try not to do that. But I just want to quickly relate a story that Leo said about the traffic circle around the London Health Sciences Unit, MOT, Multiple Organ Transplant Unit. We all, whoever went there probably had to do that circle. My complication was I had an infection that I gained right at the hospital, so it was very tough for me to regain my strength. But they made me get up and walk around that damn circle every day. I hated them for it. But I felt so badly at one point, I didn't even care about my smock, you know, any of those things, but I didn't type the back thing, it was fully open. So I'm walking around the circle, and I go past the nurse's station there, and the nurse says, hey, everything's showing up back. I just said, there ain't nothing there that nobody's seen before. And I got a laugh out of 2 or 3 of the rooms there. So it was nice to bring some levity to the people there, and it just takes me back to that sort of time. Anyways, my kidney failure was due to, like many people, being a bad diabetic. Didn't care about it, in denial about it, figured it was something that wasn't any immediate impact on me. But as my kidney started to decline, my diabetic situation seemed to start to go up, and they sort of met at the bad point. So luckily, oddly enough, I again, bad lifestyle, high blood pressure, lots of stress, poor lifestyle choices, and so on. I don't have to tell you folks that understand those choices are pretty poor. But oddly enough, I was still pre-diabetic at that point. I did manage to do some exercise and watch my diet a bit. I started to learn as I went along. What I learned, I had to have a transplant. First of all, it didn't hit home. I was in denial about it. And I knew 20 years ago that I was going to have difficulties. And oddly enough, 20 years to the month is when I got my transplant. But I didn't care about that because that was 20 years in the future, you know. So I was pretty blasé about my kidney care, about my diabetic care, and I eventually wound up paying the price, which is, you know, sometimes we learn too late, and I'm pretty good at learning too late. So when it really hit home, intellectually, I knew I needed a transplant. I knew that 20 years ago, you know, as I was going down the hill. But emotionally, it didn't hit home. It was in denial. And when it hit home to me was when I saw the surgeon about putting the catheter. Basically, the blood just drained out of my face, you know. And I had a choice. I had to face that choice of that fight or flight syndrome. What do? Do I curl up in the corner and feel sorry for myself? Or do I manage my own situation? And I decided to manage my own situation. So I became involved. I asked questions. I started watching my diet. I gathered as much knowledge as I could. I became a real pain in the tush with the people at the clinic because I would ask thousands and thousands of questions. And they as a matter of fact, I Google some questions and I go in and doctor would come into the little examination room and I said, I have some questions for you, Doug. And he said, oh yes, I see Dr. Google again, you know. So I became very much involved. And to share something with you all that I'm not going to be proud about, but I had to lose over 200 pounds. I won't tell you how many over 200 pounds before they did the surgery. So that's how out of control my life and lifestyle was at that point. When I received my transplant, which all went well about the transplant part, I received a deceased donor kidney. My living donor was not worked up in time, and deceased donor kidney came along, and I thought, talked to my nephrologist. He said, bird in the hand, so to speak. And I said, okay. And I got what the doctor called a giant moose kidney. The person who donated it was a deceased kidney, only had the one. And I guess the one overcompensated and grew, etc. So basically, I got 1.5 kidneys. So I got a freebie, you know. What do I do about managing diabetes now? Well, I'm very serious about it now, like many of you become. You know, you learn your lesson the hard way. So I do things like I make sure I get my feet checked for circulation. Make sure your circulation is good. That your feet are warm. That they're getting all the blood they need. I see a diabetic foot clinic on a regular basis. I see a diabetic nurse to help me with my diabetes and management of it. And like many of you, I use the Libre system. Jared, I don't know if you use the same thing. I use the Libre 2 system now, which has the alarm, which notifies you when you go too high or too low. And oddly enough, when I first got it, I didn't understand how it worked. And I put it on, I went to bed, and about an hour later, I think screamed like at the top of like somebody was breaking into the house. And I couldn't figure out, I found the setting on it where you can change the tones and things like this to bring it down. But the first few days, holy hell, what's going on here? I don't want this thing. Anyways, it's a terrific way of managing. As you said, it's got the puck on the arm. It's got the program on the phone. You can check your diabetes with your phone, your blood sugar level, tells you right away, which is a great thing to do because it doesn't involve the finger pricks anymore, which are terrible after a while. You just lose all feeling in the end of your fingers. So anyways, I guess what I want to share with you some more is I'm asked sometimes, what's the one thing I would have wished I'd known about this going in? And I keep on saying, there's not one thing, there's a whole bunch of things. And that's where I got involved. Get involved with everything, get you more knowledge. At that time, that's where I'm going to put in a plug for TAP. I knew absolutely nothing about diabetes when it came time to using insulin. Nothing. I didn't discuss it with anybody, never. My own fault, no doubt, because I was in denial about that as well. But so working with Diabetic Clinic helped quite a bit to get the knowledge about how to work that. I learned the glycemic index, learned high carbohydrate counting, just like the rest of us is pretty well. And greatest friend, Nova Rapid, never leave home without. That is a big help when you sort of feel you want to indulge. And oddly, it's not part of management is learn to control your drivers. I check my blood sugar when I signed up to this thing tonight. my blood sugar has just been going up and up and up and all night. So it's your emotional status, your mental status also affects it. It can be, your normal range, and all of a sudden somebody will freak you out, you'll have go up by 2 or 3 points. However, I'm proud to say at this point tonight, my average A1C over the week has been 5.8. That's my average glucose was 5.8. My A1C average is 5.5, and I'm 97% in target. So my doctors are pretty impressed with that. As a matter of fact, my endocrinologist threw me out. He said, "There's no reason for me to see you anymore. You got a problem, give me a call, but otherwise leave me alone." So I just want to conclude one thing. I would gladly do this diabetes administration anytime over being on dialysis and suffering kidney disease, anytime a day whatsoever. For me, it's become routine. You can learn about it, you can manage it. You're right, there's weight loss issues. It's so tough to lose weight on once you start insulin. But if you tippy-toe your way through it, you can lose half a pound here and there on the way and sort of get some slow wins. But it is a difficult process. So that's sort of it. It's difficult, diabetes. So you have to be cognizant of the risks. You have to manage your treatments and injuries. You need to work with your diet and exercise, get serious about that. You need to, what's the right word? You need to be cognizant of those things that you shouldn't have, as well as those things that you should have. You read these diabetic books and there's all sorts of listings and things. I just go by categories. And after a while, you look at something and you can guess pretty well what the calorie content is, what the carb content is, because you learn these over a couple of years. So I think don't be afraid of it. If you develop diabetes afterwards because of the anti-rejection drugs, you can manage it. And it's a lot better than being on dialysis and not having a kidney. That's about it for me tonight. Thank you very much for listening.
Thank you so much, Peter. And all of the panelists, really appreciate you guys sharing so openly and all of that. I'm going to stop the recording.